Hey guys, so in this video I wanted to talk about certain sites that you are not supposed to draw blood from. If you notice me looking down, I have my laptop with some notes that I wrote placed just underneath where the camera is. I have the camera on a tripod right now. And so I had somebody ask me a while back about why you're not supposed to try to draw blood from a certain area of the body. And so I wrote some notes about which sites you should avoid when trying to get a blood sample from a patient. And hopefully this helps somebody if you were kind of curious about why you shouldn't draw from a specific site. So the median cubital, and cephalic veins of the arm are used most frequently. So that would be in the middle here. But on the basidic vein on the dorsal part of the arm or dorsal hand veins are also acceptable for venipuncture. This one that is right in the middle though, that is going to be the most popular site to check. So if you are able to get blood from here, you should definitely try to do that. Foot veins are a last resort, and actually when I was in phlebotomy training, we were told that unless you have approval from a physician or from your patient's physician, I should say, that you were not to draw blood from the feet. So I learned this when I was living in the state of Indiana. This may be different for different states, but we were told when we were in our training that if you wanted to, or if you needed to draw blood from the feet, unless you're doing an infant or a child under 1 year of age or under walking age, if they're less than a year old, then you had to get prior authorization from their physician before attempting to draw blood from the foot. So certain areas, like I said, you definitely need to avoid when you're choosing a site. So if the person has extensive scars, like if they have been burned in the past or if they have surgical scars, definitely avoid those areas. And one of the main reasons is because it is difficult to puncture scar tissue. It could also cause potential damage to the patient's skin, but it makes your job much more difficult if you try to puncture scar tissue. Obviously, you don't want to be putting a needle into a burn, things like that. That should be common sense. But again, just letting you know. So that's why it's definitely rougher to try to get through scar tissue to obtain a blood specimen. Also, if a person has had a mastectomy, for those of you who don't know, that is surgical removal of a breast. So if this person has had a mastectomy, the upper extremity on the side where the mastectomy was, you're not supposed to use that because test results can actually be affected due to lymphedema. So let's say I had a mastectomy on the left side. So this is where my mastectomy was. You would not want to use this left arm. You would want to try the right arm, and there may be a situation where you can't get blood from the right arm. Then you would need to talk to the nurse or see what else could be done. Talk to the physician, whatever. But you definitely don't want to try to draw blood from my left arm if I had a left mastectomy, because like I said, the test results can be skewed if you do attempt to draw blood from there. So if you try to draw from a hematoma, this could also cause your test results to be skewed. And if you do have to draw on a side where there is a hematoma, make sure to collect the specimen from the furthest point away from the hematoma, just because you want to minimize the risk of your test results being skewed as much as you possibly can. Obviously, if there was no other site available to you, then you just kind of have to deal with what you've got, but try to make it as distal as possible from the hematoma, just to make sure that you're lowering your risk of skewed results as much as you can. So if the person has an IV, these fluids can actually dilute your specimen, which would also skew test results, or can. So if you have an IV going, collect from the opposite arm, not the arm where the IV is in, if possible. Otherwise, if you have to do it on that same arm, you should follow the following steps. So turn off the IV for at least 2 minutes before you proceed with the venipuncture procedure. Apply the tourniquet below the IV site. So if the person has an IV here, you're gonna wanna apply your tourniquet probably right about here so that you can draw blood from the hand. Select a vein other than the one with the IV. That should be common sense, because obviously IV is intravenous, meaning it goes into the vein. Perform the venipuncture. Once you've selected the vein, obviously, draw 5 milliliters of blood and then discard that blood before you take the blood from or into the specimen tubes. So you're going to basically waste the first 5 milliliters of blood. Sorry about that, my camera actually stopped in the middle of me recording. But so there are a few different things to mention. Not all of these are going to be specific to phlebotomists, but maybe more specific to nurses. So if they have an IV line, you are actually able to draw a blood specimen from an IV line, but as a phlebotomist, unless it is within your state's scope of practice, you are not allowed to do this. Or if you have an IV certification, I'm not sure. It depends on the state. There's different requirements. Just check to make sure that you are actually allowed to do this in your state before you attempt to do so. Otherwise, the nurse may be able to collect the blood specimen for you from the IV site, him or herself. So drawing from an IV line may actually be a way to avoid having to do a venipuncture, but it can introduce problems. The line has to be flushed first. When using a syringe inserted into the line, blood has to be withdrawn slowly, otherwise you get hemolysis. There's a whole lot of problems there, which is why phlebotomists are not really allowed to do this. If the person has a cannula, fistula, or a heparin lock, there are special policies that hospitals may have regarding the use of those devices. And in general, blood should not be drawn from an arm with a fistula or a cannula without talking to the physician first. So a lot of people who have fistulas are dialysis patients. And so you may notice like the veins in their arms look huge. That is because they use these fistulas for dialysis access only. That would really not be where a phlebotomist would be drawing blood from, because you could damage that fistula, you could ruin the fistula, you could do a lot of damage. And so it's better to just, talk to someone else. If you don't know what you're doing, if you don't know that you should do it, or whether you should or you shouldn't, don't do it. Stop and ask. If an extremity has fluid, if it has edema, then this fluid accumulation in the tissue can alter test results. So you just have to be very careful about using edematous extremities or extremities with a lot of fluid accumulation in them, because you don't want to skew their test results, because then they're going to have to repeat tests. Skewed test results can also cause a doctor to prescribe medication or give medication that the person may not actually need. So you just have to be very careful. With that being said, I hope this was helpful. If you guys have any other questions, please let me know. I would be glad to address them in a future video, and I will talk to you guys next time.